Hi, and welcome to another episode of Hot Takes with me, the Silver Fox. The NHS in Scotland is in dire straits. This is a result of years of chronic underfunding and a lack of agency by the Scottish Government. This could be squarely laid at the door of the SNP and its goblin-in-chief, Nicola Sturgeon. Even she cannot lie and spin her way out of this one. It is so bad. Even mainstream news articles are now starting to call her out and point out the flaws in this woman's character. We're going to have a look at an article now that claims that the NHS has not been dragged into the 21st century by the SNP. Personally, I don't think it's even in the 19th century. But we'll take a look at the article and see what is happening. So, as I've literally just said, Nicola Sturgeon's government has failed to drag the NHS into the 21st century. Daily Record political editor Paul Hutchins says that the problems with the NHS are as much about reform as they are as a lack of money. And certainly money is an issue, or the lack of money is an issue. But you can only spend the money in certain ways, as Nicola's finding out. And of course, her priority for spending money, wasting time, putting all her efforts are to make sure that the women of Scotland are put in harm's way, that children are being allowed to change their gender without anyone sort of overseeing and safeguarding them, to ensure that men with mental problems can go and sit in safe spaces for women or go into women's jails, things like that. No addressing the issues of the NHS, because that's not important to her. She has her agenda. Her agenda, of course, which is always to push the sexuality, to get those ages younger. It's always getting them younger, get them in there, sexualising of very small people, because we know what the P in SNP stands for. But anyway, we'll get into the story. Scotland in 2023 is a dangerous country in which to fall ill. As the First Minister said in her NHS press conference, hospitals exceeded 95% capacity on January the 4th, compared to pre-pandemic levels of 87%. And this isn't anything to do with like ambulance strikes or nurses strikes or anything like that. This is just the overwhelming number of people pushing on the NHS. They just don't have the capacity to cope because they are not getting any money. They've got an ever-growing population, but they have not had sufficiently increasing funds to meet the needs. And that's because Nicola Sturgeon is spending those funds on things like referendum campaigns and court cases to make sure that the referendum campaign can continue and things like that. And also, there's lots of millions of pounds missing in Scotland for which nobody is questioning where it's gone. But that's a different video. Thousands of patients are waiting longer than 12 hours to be seen in A&E, with some folk trapped in ambulances. The sick are struggling to get admitted to hospital, while the healthy are being kept in bed due to bed blocking. We often hear about the latest crisis being unprecedented, but this time the medics are not exaggerating. Although they do go on every year. Oh, it's the worst the NHS has ever been every year. And it probably is, because there's, like I say, an ever-growing population. But anyway, Nicola Sturgeon's remedy resembles the same type of sticking plaster solution that her government has reached for in the past. More cash for NHS 24, extra investment for care packages, and all paid for by higher taxes. And of course, as you keep increasing the taxes, people start leaving Scotland and moving their money away and start investing elsewhere. So what you'll end up with is not only a bankrupt and awful country, but because everyone with the money's left, but you'll also end up with a terrible NHS system because nobody's there to pay it, because you cannot tax your way out of debt. You need to grow your way out of debt. But of course, being a good little Marxist, Sturgeon doesn't understand that. Anyway, the problem is that the central issue, rising demand for health services set against a shortage of staff, predates the pandemic. Right-wingers believe charging for basic services like GPs is the best way to reduce demand in the 21st century, and this unpalatable shift would create a two-tier system based on the ability to pay and should be rejected outright. It absolutely should be rejected outright. I'm right of centre. I don't want to have a two-tier system. If you're paying in, then you are entitled. Don't pay twice. Just make sure. Simple thing is stop GPs being gatekeepers to consultants. If you can do that, then you get a lot more people go directly to consultants and won't be wasting the GP's time. Anyway, a better and more progressive way of reaching the same goal is to ensure fewer trips to the doctor by having a healthier population. This requires vigorous government policies that ensure Scots smoke and drink less, as well as eating healthier foods and exercising more. And I'm sure that there are many Scots that do smoke less or not at all, and drink less or not at all. Eating healthier foods, fine. But can you imagine trying to force this on, someone in Glasgow, down in the city, in one of the Sink estates in Glasgow? He's sitting there, and the only thing he's got in his life is a wee cigarette, a wee tot of whiskey, and whatever comes out of the takeaway on a Friday night. Yeah, you can talk a good game, but it's not going to happen easily. The only way you're going to get rid of cigarettes is if you outright ban them. And no government really wants to do that because ka-ching. Funding extra care packages to reduce bed blocking is also sensible, but the cash will have little effect if the social care staff are paid only £10.90 an hour. Would you want to sit there, do a physically demanding job involving wiping somebody's backside, administering, medication, dealing with dirty people sometimes because they're not capable of getting to a shower, and someone's going to pay you not even £11 an hour for it? That's the problem. You need that to be £15-16 an hour minimum to make anyone really want to do it. Poverty pay has led to a stampede out of the sector. No shit. And created a vacancy rate that can only be solved by a huge increase in take-home pay. It is simply not a job that pays well, and it is not a job that anyone really wants to do. And ultimately, when nobody's doing it, you've got to pay more. Another failure has been the lack of structural reform since the SNP took over. That surprises no one. Scotland has a population of around 5.5 million, yet somehow funds over 20 NHS boards. Duplication and waste are rife. No shit, Sherlock. I mean, you've got to think, what have you got? You probably need NHS board for Glasgow, Edinburgh, Aberdeen, Dundee, maybe Stirling, Inverness for sure, because it covers a bigger area. So you've maybe got 6 main city sort of, large town city kind of sizes. The rest of it, you could divide that up into regional, 4 to 5 regions. You've immediately got it down to maybe 10 or 11 boards. It's half the number of boards. And that's money that can be then set aside and pumped back into patient care. But nobody wants to do it. Nobody wants to grasp that nettle because these left-wing governments that you've had effectively since 1997, these left-wing governments in Scotland dare not do it because it might mean that somebody loses their job. And that's a no-no. That's an absolute no-no. Meanwhile, people are dying. At the same time, the NHS is struggling to keep up with the app-based digital reality many Scots take for granted. The last time I tried to book a GP appointment in Edinburgh, it took over 50 attempts at calling the number before a staff member picked up, and the lack of an online booking system is lamentable. Einstein once said, insanity is doing the same thing over and over and expecting different results. Pouring more money into an unreformed service and hoping for a cure is a living example of Einstein's barb. And I'm going to cut across here. I mean, this guy's absolutely right, but I'm going to cut across here, and I'm going to show you in one headline. There's my dog. Hello. I'm going to show you in one headline absolutely how bad Scotland's NHS service has got. And it just made me laugh. I mean, it is shocking, but it is a total indictment as to the NHS under Nicola Sturgeon. And here we go. Bang. A Ukrainian refugee flew back to Kiev to see a doctor as the waiting times in Scotland are so long. This is a guy who actually flew... Oh, it was a woman, actually. I do apologise. It was a woman who flew back to a war zone because the medical care in a war zone is better than the medical care she would receive in Scotland. Nicola Sturgeon is destroying the NHS in Scotland because she just doesn't give a shit. Anyway, I'm going to finish there and come up. I mean, honestly, you couldn't make it up that Scotland's NHS is so appallingly bad, people would rather go to a war zone. People of Scotland, remind me why you vote for the SNP, because I can see no reason for it. And the sooner that mad, evil, poisonous dwarf is kicked out, along with all her Marxist mates, and you get someone in Scotland who can actually do the job, who actually cares, who actually wants the people of Scotland to have an NHS, to have an education system, to have care, to have a police force, to have safety for women. The sooner that happens, the better. It's up to you. Go for it. Anyway, I'm going to stop now. Thank you very much for listening if you've made it to the end. If you like what you see and hear on the channel, please do hit that subscribe button down there. Ring that bell for notification of future outputs. Leave a like, leave a comment. Please share this video. And until next time, stay safe, stay well. Absolutely stay well. Don't get ill. And goodbye.